Hi, my name is Jenny Thompson, and I'm sure you've all seen a lot of people posting their pictures of them doing skin to skin with their babies. A lot of moms and dads doing skin to skin with their little newborns. So today we'd like to kind of talk a little bit more about why skin to skin is super important for moms and for breastfeeding. This is Kyra Kanya.
Hey!
And she is one of the midwives in our area and also owns the Natural Birth House in Broussard, Louisiana. So we wanted to talk to you a little bit today about why we think skin to skin care for moms and babies is super, super important. So do you want to talk to us about the golden hour?
So Jenny and I actually talk about the golden hour all the time when she attends births as a doula here at the Natural Birth House. One of the things about the golden hour is a lot of people don't realize A, how important it is, and B, that it's not just an hour, which we're going to get to in just a couple of minutes. Just preparing for this video, Jenny and I could hardly contain ourselves with all the excitement of the information we were gathering. So we're going to try and keep it really focused on breastfeeding today. So starting with the golden hour. The golden hour is a set of evidence-based protocols that support moms and babies being together after the birth, immediately after the birth, which produces and kind of helps stabilize mom and baby both physically or physiologically and emotionally. So Jenny, tell us some of the benefits about keeping mom and baby skin to skin that first hour.
Okay, so well, first of all, the benefits are huge for both mom and baby. It's the biological norm to keep moms and babies together. We do it with our animals. We should be doing it with our moms and our babies. And the reason why it's super important is because it helps to increase babies' oxygen saturation levels. It actually helps to stabilize baby's body temperature. Mom's breasts actually after birth, are the perfect little heater for baby. It actually helps to stabilize their glucose levels. What else does it do?
And it helps them initiate breastfeeding sooner.
Yes.
Because in the golden hour, if you had to define the golden hour, right? It's not just skin to skin, although that's amazing, and I love that just the past few years the hospitals are starting to make an effort to promote that.
Yeah.
But the golden hour is more than just skin to skin, which is why it does help initiate breastfeeding.
Right.
So if we had to define it, it would be delayed cord clamping, baby skin to skin on mom, not skin to nursing bra, not towel in between them, baby skin touching mama's skin. And in addition to that, we looked up evidence. We cannot find the actual words that say birth etiquette or a quiet, supportive environment. But what it does say is we should be delaying all newborn procedures that can be delayed. But in addition to that, one of the things that we like to do here at the birth house, and that's one of the things we talk about all the time, is it's not just delaying these important and necessary tests, but also this quiet, calm, peaceful environment that is supportive of the mom and the baby during that golden hour, which helps them breastfeed their baby because, like Jenny said, their temperature's stable, lower levels of stress, higher levels of the love hormone. So both mom and baby are primed in those first few moments to breastfeed, which is amazing.
Yeah. And babies are super, super smart. They're really intuitive. So if there's a lot of chaos in the birth room, even if everything is normal, sometimes families getting super excited or the bright lights or whatever, it can cause a lot of stress in the baby, and it kind of can inhibit that natural flow of hormone and what needs to occur after mom and baby are finally together. So we try to support that moment, keep it quiet, keep it respectful, and like I said, babies are super, super intuitive. I think they're smarter than we give them credit for. So I know here at the birth house, it's really unique to see them have their babies here because everybody's talking to the baby. It's just another person in the room, and I swear they know what we're saying to them. So it's really beautiful to watch, and it's also for the moms that maybe need a little repair after the birth. If we have baby with mom and they're breastfeeding already, mom needs like a little less medicine down
Yeah.
there. It's a natural analgesic, so it's really, really wonderful all around. We could probably go on for hours about how much we believe in this, because for a long time, hospitals weren't keeping babies with moms. They were in the same room, which is a huge step forward. But now that the hospitals are starting to do that, I think everybody is really starting to see the benefits, including for moms who end up having to have a cesarean. Keeping babies with mom is a huge help. So it's nice to see things are changing and moving forward here in our area.
And we were just saying, we were reading about there is no evidence that says that moms and babies should be separated after a C-section. In fact, if moms and babies are together while the rest of the surgery is going on and baby skin to skin, baby gets to initiate breastfeeding. And if baby's initiating breastfeeding, we read today that exclusive breastfeeding, which is best kick-started within the first hour of labor of the golden hour, moms and babies being to skin, vaginal birth or C-section, hospital birth or home birth or birth center birth, it doesn't matter. But exclusive breastfeeding reduces preventable deaths for children under the age of 5 by 800,000 a year. Just by exclusively breastfeeding. More women are likely going to exclusively breastfeed if we honor the golden hour, or like we say,
It's
2 to 3 hours
Yeah.
after the birth.
Yeah, it's a beautiful feeling to see moms and babies together here at the birth house for 2 to 3 hours. I mean, that's just kind of the norm here. I am seeing it more at the hospital where babies are with moms for at least an hour, but it's beautiful whenever a doula can leave the hospital and the baby is like still with the mom and dad, that they get that special bonding time. So it's huge.
So before we wrap this up, I want to talk to you guys about some ways to prolong, first of all, to get the golden hour, no matter your birth location, and ways to prolong it. First of all, I'd like you to bring your own towels to your birth. Now, I know this sounds a little bit crazy, but your towels from your home that your kids held or your husband packed are filled with your germs from your house, which colonizes babies' immune system for the rest of their life. So bring 2 towels from your home. A quiet room. We talked about birth etiquette. Ask the people who are attending your birth to be silent after the birth, except for dad, of course.
Yeah.
And we see that over here, that
Yeah.
as providers, we're so excited the baby's here, we're trying not to shout. But moms and dads, if you just give them a minute, they like lift up their babies, and the 3 of them are the only people in the room. And that is really part of what the golden hour really encompasses.
And baby knows the parents' voices.
Oh, yeah.
So anytime we're talking to the babies, sometimes they get like a little upset, but if they're with, mom and dad and hearing their voices, they're super, super calm and they're more likely to latch on.
Yeah, dad too, like she was saying, not just mom. Babies know dad's voices too. Okay, so no phones, no visitors. This should be pretty simple, that if you don't have dad interrupting the first hour by texting pictures of the baby to family members, and you really take that first hour together, that first hour of the golden hour can really be protected, and you're more likely going to initiate breastfeeding if your birth team is present and giving you the time and the space to let your oxytocin flow.
Yeah. Everybody can wait. And I also encourage dads to bring with them, either to the hospital or even here at the birth house, wear like a little zip up hoodie with like a little, preferably a plastic zipper, not a metal zipper, because those can be kind of cold. And especially if it's like, it tends to be a little cold at the hospital, so dads can put on the hoodie, their shirt can be off underneath, they can zip the hoodie down and keep baby in there with them, and it's beautiful. If something has to be, done with mom, then at least baby can stay with dad, and they're nice and warm, and dad doesn't have to feel like he's walking around with his shirt off everywhere.
And evidence supports that if mom can't have the golden hour, dad should be stepping in to do it. So skin to skin with someone, preferably mom first, dad second. But absolutely, that's what we should be doing. All assessments should be done on mom. Most hospitals already do this, but maybe double check when you get there. The APGAR and the initial checking babies' oxygen levels, and heck, even at the birth house, we resuscitate babies in mom's arm's reach, where moms can talk to their babies. So all assessments should be done on mom. No strangers in the room. That's a little bit harder in the hospital setting, but preferably letting anyone who needs to take care of you ask their questions while you're pregnant so that you can really honor that first hour postpartum. And last but not least, nursing with gentle encouragement. So we were just talking about this awesome nurse we used to work with who's such a great breastfeeding supporter. But after the birth, may I have the baby?
Yeah.
After the birth, she would grab mom's breast and shove it in the baby's mouth, whether he was screaming or peaceful. She was going to get that baby to nurse. And like I was telling Jenny, imagine you're trying to talk to me and I shove an apple in your mouth. That's really going to tick you off. Yeah. So honoring the first hour for the golden hour is a quiet, peaceful environment, so mom and baby naturally will come together and baby and mom will want to nurse. It's not forced, it's just encouraged by keeping baby close to the breast.
Yep. And it's amazing. They'll do it by themselves. If you just kind of leave them be and have baby tummy to tummy on mom, they will, especially if it's been like an unmedicated birth, they will bob around and find the breast just all on their own. We don't have to force it. Sometimes we have to, gently encourage them, but there's different ways that you can hold the baby to encourage that. But most of the time, they find it themselves. So.
And I think that's it. I mean, like I said, we could talk about the golden hour for an entire hour, but just trying to encourage you guys to get your golden hour honored and preferably stretched out for those 2 or 3 hours that we've seen it be, so that breastfeeding can go and get started off on the right foot.
So thanks. We hope that all of these tips can help you to have that longer golden hour that you seek, and to help you be successful in your breastfeeding relationship with your baby. So thank you.
Thank you. Bye-bye.